I recently had a patient interview where I was asked by the patient's mom if I knew anything about the different effects of Keppra versus the generic version. Keppra is a brand name drug used to treat seizures, and the reason she was asking was because she noticed that her child's seizures had increased since she switched to the generic version. The reason she switched was because the brand name drug was getting too expensive and her child needed to keep having the medication refilled because of her particular neurological condition. At the time, I actually didn't have the answer to that question, but I told her that I would do some research and share with her what I found the next time that I saw her. In my research, I found some really interesting things regarding the differences in the brand name versus generic anti-seizure drugs. But I also found some very interesting things that suggest that for a majority of drugs, there is no significant difference between the brand name drug and the generic one. After searching the literature, I found the generic drugs are very closely regulated by the FDA and undergo very rigorous testing before being allowed to be sold to the general public. An article published by the Epilepsy Society in the UK said that this rigorous testing assures that generic drugs be required to be bioequivalent. This means that they should contain the same active ingredient as a brand name drug with identical dosage, identical intended use, and identical route of administration. However, they did state that there are some subtle differences when it comes to the inactive ingredients in generic versus brand name drugs. All drugs contain inactive ingredients, such as food coloring, flavoring, fillers, and binding agents that all help to make up the pill itself. As an example, Lexapro, which is a drug used to treat depression and generalized anxiety disorder, is typically dosed with 10 milligrams of active ingredient per pill. That physical amount is actually much smaller than the pill itself. So the remainder of the pill is actually made up of all these inactive ingredients, or excipients is what they're called. And sometimes drug manufacturers will use binding agents like gluten, cellulose, or starch that work to hold the tablet or the pill together. So these are the types of ingredients that can vary from one version of a drug to another. Occasionally, it is these inactive ingredients that may also affect how the individual responds to the particular version of the drug that they are taking. Therefore, if the person is allergic to gluten, dairy, or some other substance, then it becomes especially important to read the full ingredient list to avert any adverse reactions. In terms of drug effectiveness, generic drugs are just as effective as a brand name drug, considering that the active ingredient is the same in both cases. In the case of anti-seizure drugs, however, there may be one exception that can affect the absorption and the distribution of the drug throughout the body. This is because of what's known as a drug's therapeutic index, which is a ratio that compares the minimum toxic concentration of the drug to the minimum effective concentration of the drug. This says that in drugs with a low therapeutic index, even minute variations in the chemical composition, including variations in these inactive ingredients, will have a higher probability of affecting the drug effectiveness and potentially also increase the risk of side effects. While the majority of drugs don't fall into this category of having a low therapeutic index, some reports document that low therapeutic index in some anti-seizure drugs like phenytoin, which can very likely increase side effects as described by the patient that I was talking about earlier. This is potentially what people refer to when they say that they've experienced negative side effects when switching from brand name drug to the generic version. However, it is also important to note and to take into consideration that there is insufficient evidence in the literature to generalize these findings for two main reasons. Number one, there are very few studies that compare generic substitutions to brand name anti-seizure drugs, particularly with Keppra. And two, majority of what is currently in the literature are case reports, which are anecdotal and retrospective. Additionally, a systematic review and meta-analysis of seizure outcomes after switching from brand name to generic anti-seizure drugs found that the available evidence does not suggest an association between seizure frequency and drug substitution. Although the current literature suggests that generic substitutions to brand name drugs is generally safe, there needs to be further controlled and prospective studies to better understand the risks and possibly serious consequences of making these drug substitutions for drugs treating more involved disorders and conditions like depression or like seizures, particularly for drugs known to have a low therapeutic index. However, rest assured, the majority of drugs don't fall in this category. So next time that you get sick or have a headache and are pondering one medication to get, like Tylenol, for example, know that the generic version marketed as acetaminophen is just as safe and is just as effective. And that in this case, the only true difference is the label and the price. Thank you.